The U.S. President-elect Donald Trump has selected Robert F. Kennedy Jr. for Health Secretary. He will lead the Department of Health and Human Services.
Now, this is the United States' top health agency. Kennedy ran for president in this year's election as an independent before dropping out in August and endorsed Trump in exchange for a role in the Republicans' administration.
Robert F. Kennedy Jr., he came in. And he's going to help make America healthy again. And now he's a great guy, and he really means it. He wants to do some things, and we're going to let him go to it. I just said, but, Bobby, leave the oil to me.
The Department of Health and Human Services oversees the Food and Drug Administration, the Centers for Disease Control and Prevention, the National Institutes of Health, and the massive Medicare and Medicaid service programs, which provides health coverage for the poor, those aged 65 and older, and also the disabled.
In his social media posts and interviews in recent weeks, Kennedy indicated his priorities include addressing what he calls a chronic disease epidemic of conditions including obesity, diabetes, and autism, and reducing chemicals in food. Kennedy also suggested he would gut the 18,000 employee Food and Drug Administration and replace hundreds of employees at the National Institute of Health.
Kennedy has been criticized for making false medical claims, including that vaccines are linked to autism. He opposed state and federal restrictions imposed during the COVID-19 pandemic and was accused of spreading misinformation about the virus. Kennedy disputes the anti-vaccine tag, saying he wants more rigorous testing of vaccines instead.
In an interview in March, when he was still running for president, Kennedy said Americans who want a vaccine for themselves or their children would continue to have access to them if he were to be elected. But he said he doubted the efficacy of measles vaccine.
I'm going to require, first of all, anybody who wants to take a vaccine, I'm not going to get in their way. If you want a vaccine, or if you want to vaccinate your children, those vaccines will be available. But I am going to tell the truth to Americans. I'm going to do for the first time good science, right? When I was a kid, there were 3 vaccines, and I took all 3. There were 3 that were mandatory, that were recommended, which essentially means mandatory, and I was compliant.
And for more on the story, our correspondent Susan Terani sent us these details from New York, where she told about what the Republican sweep in the 2024 elections mean for U.S. policy moving forward. Take a listen.
The GOP control over the White House, Senate, and House opens the door for Donald Trump to advance his core agenda, which is stricter immigration, energy production boost, and conservative judicial picks. But there is a balancing act here. Trump and the GOP need to keep moderates on board as they tackle these pressing issues for their movement. And while they have a unique opportunity for sweeping reform, they must tread carefully to avoid backlash that could impact their standing in the 2026 midterms.
Susan also told us about the implications of Robert F. Kennedy Jr.'s nomination as the Secretary of Health and Human Services.
Kennedy's nomination brings an advocate for environmental health to the forefront. For decades, he's been working on protecting the environment, addressing pollution, and holding corporations accountable for their environmental impact, issues that deeply affect public health. His leadership could encourage a more holistic approach to health that considers environmental factors as well. And while his views regarding vaccination is controversial, his commitment to transparency and questioning the established systems might bring fresh perspective on accountability within health institutions. Now, if he can work collaboratively after this nomination, he may be able to make a very big difference in America's obesity crisis and health problems as well.